Sierra Dental, for me, actually, if I were to come in as a patient, it's very bright, friendly. All of our front office girls are so welcoming. I witness it just kind of walking through the office. It's a very clean office. That's something that's really big to me. Infection control is a big deal to me. I would feel comfortable, and I do. My family comes there. I've brought my aunts and my grandmother, my parents, my children sit in those dental chairs, so I'm very confident in Sierra Dental. And I honestly wouldn't be there if I wasn't. I think the patients, and I do have patients tell me that, it's very comfortable, but beyond that, we have a very awesome team, and we have so many departments, but we're always striving for patient excellence care, and I feel like when you have that, when you have your coworkers who are willing to work together in each area, it allows me as a hygienist to really focus on my patient. And the care for that patient is even better because I don't have to think about, oh, I forgot this instrument, I have to grab that, or I need this x-ray. Like, everything I have is provided, and if I need it, literally there's a touch of the button and I can get the help that I need. And my patients can feel comfortable sitting in one spot and having their needs met, in that one appointment. We have an awesome team from management to the back office. I would say that's really what's kept me there. We get together and we talk about how we can do what we do even better. How can we make the patient even happier? And that's really our main goal. Working there for 11 years, I've watched us evolve into something really great, and to know that my management team wants to be even better, it makes my job even more exciting because, we went from just general dentistry to adding the orthodontic team, and then now we have a oral surgeon on board, and the patients love that they can stay with their general doctor, come to their their regular dental office and see the specialist in the same, right around the corner in the same building, which allows the specialist and the general doctor to work side by side, and that patient care is just keeps it just so tied close together that the chance of error is minimal because you have such a great communication in the office. So it's just, I see us always doing better and trying to provide better for our patients. I would think that, honestly, the most rewarding part for me is when it is that fearful patient. That is really big for me because I hate to see people being held back because of fear in any part of their life. And that this is, honestly, I can't, go out and save the world, but I know when I have somebody in my chair and they're just, when you see the fear on their face, and a lot of it's embarrassment, and they don't even want to smile fully. But by the time our treatment, say there's, several appointments we have together to get them back to health in their mouth, but when they come back now, and they're coming back, some of these patients hadn't been in the dentist for 20 years, and they're coming back every 3 months to see me, and they hug me when I call their name in the waiting room, and they're so excited that, they went and had family pictures, and they're smiling again, and that confidence is back, and that fear is diminished. That is my favorite patient. I have had 1-year-olds that just have their first little tooth popping out, and I've had 80-somethings. So there's such a range, and they're all very different, how I educate them or how our appointments go, but we see all ages. If that patient will sit in the chair and communicate back with me and cooperate, we see them. There's no, line that we're gonna say, oh, you're too young or you're too old. We see, special needs patients. Whatever care we can give, we'll give if that patient allows us. Children are a lot of work. They're fun. They actually kind of give you a break in the day because you can laugh and kind of, be silly and lighten up a little bit. They bring a lot of joy. I like make the little balloon out of the glove or give them their stickers, and they're so excited. And some of them just want to talk your leg off, and some of them want to cry, and you got to kind of become like the clown and get that whole, open your mouth. I just had one the other day that she wouldn't open her mouth for anything, and you have to just kind of keep talking, and you have to do a lot of extra work sometimes. But even with those little ones, every time I see them, they're more confident in their visits, and it's kind of fun. And I've seen a lot of them, grow up. Sometimes they walk in 6 months and they're, 3 feet taller, and you're like, what in the world's going on, But kids are awesome. We have a lot of fun with them, and usually, you see them from when they got their first tooth and going through braces, and then now they're in college, and it's kind of fun watching them grow. And these families that return, you really do build a lot of relationships. So I enjoy working with them.